The Department of Education, DepEd, of the Philippines recognizes the integral role of health, nutrition, and water, sanitation, and hygiene, WASH, in ensuring a conducive learning environment for Filipino learners. These aspects are essential for students to fully benefit from quality, equitable, culture-based, and complete basic education. To address persistent challenges such as malnutrition, poor hygiene, and health-related issues among students, DepEd has issued specific guidelines and implemented comprehensive programs, including the Oplan Kalusugan SA Department of Education, OKSA DepEd, and the Comprehensive Water, Sanitation, and Hygiene in Schools, WINS, program. Oplan Kalusugan SA Department of Education. DepEd launched the Oplan Kalusugan SA Department of Education, OKSA DepEd, in 2018 through DepEd Order No. 28, Series of 2018. This initiative serves as the umbrella program integrating all school health and nutrition initiatives to ensure a holistic and sustainable approach to the health and well-being of learners and school personnel. It aims to address pressing health issues that affect learning outcomes and promote healthier behaviors within the school community. The primary components of the Oplan Kalusugan SA Department of Education include School-Based Feeding Program. As mandated under Republic Act No. 11037 or the Masustansiang Pagkain para sa Pilipino Act, the school-based feeding program targets undernourished learners in public elementary schools. This program provides hot meals and, in some cases, milk feeding to combat severe wasting and stunting. The initiative prioritizes children who are categorized as undernourished based on the World Health Organization Child Growth Standards. Gulayan SA Paaralan Program. The Gulayan SA Paaralan program encourages schools to establish vegetable gardens, which serve as sources of fresh produce for feeding programs and a platform for teaching students about sustainable agriculture and nutrition, micronutrient supplementation, deworming, and vaccination. To complement the feeding program, DepEd also provides micronutrient supplements to address deficiencies, such as iron and vitamin A. Deworming campaigns are conducted to combat intestinal parasitism, while vaccination initiatives focus on protecting children from preventable diseases. Health examinations and medical services. Regular health checkups and medical services are conducted to monitor the overall health status of learners and identify those requiring further medical attention. Mental health and psychosocial support services. Recognizing the importance of mental health, the Oplan Kalusugan SA Department of Education integrates psychosocial support and counseling services to help learners and school personnel cope with mental health challenges. Comprehensive Water, Sanitation, and Hygiene in Schools, WINS, program. The Comprehensive Water, Sanitation, and Hygiene in Schools program is another key initiative by DepEd aimed at improving the overall hygiene and sanitation practices within schools. The program's goal is to create safe and sanitary environments that promote health, reduce the risk of diseases, and enhance students' ability to focus and learn effectively. Key guidelines and provisions under the Comprehensive Water, Sanitation, and Hygiene in Schools program include access to clean water and sanitation facilities. Schools are mandated to provide students with access to safe drinking water and gender-sensitive, functional toilet facilities. Adequate facilities are essential to prevent the spread of diseases and promote a hygienic learning environment. Hand washing and hygiene promotion. The program emphasizes the importance of regular hand washing with soap and clean water. Schools are encouraged to establish hand washing stations and integrate hygiene education into the curriculum. Waste management. Proper waste disposal systems, including segregation of biodegradable and non-biodegradable waste, are implemented to ensure a clean and sustainable school environment. Health education and awareness campaigns. Schools are required to conduct regular health and hygiene education sessions to raise awareness about personal hygiene, proper sanitation, and disease prevention. Specific guidelines and implementation strategies. Both the Oplan Kalusugan SA Department of Education and the Comprehensive Water, Sanitation, and Hygiene in Schools program operate under clear implementation guidelines to ensure effectiveness and sustainability. Targeted beneficiaries. Priority is given to students who are severely wasted, stunted, or undernourished, as identified through regular health assessments. These learners are enrolled in feeding and supplementation programs to address their nutritional deficiencies. Monitoring and reporting. Schools are required to monitor the progress of health and nutrition programs and submit regular reports to the DepEd Central Office. Monitoring ensures accountability and allows for adjustments to improve program implementation. Stakeholder engagement, partnerships with parents, local government units, non-governmental organizations, and private sectors are encouraged to strengthen the implementation of health and nutrition programs. Collaboration allows schools to leverage additional resources and expertise. Capacity building for school personnel, training sessions for teachers, school administrators, and health coordinators are conducted to equip them with the knowledge and skills necessary to implement health and nutrition programs effectively. Addressing nutritional challenges. The nutritional status of students, as reported in school year 2018 to 2019, reflects a dual burden of malnutrition. While severe wasting and stunting remain prevalent due to poverty and inadequate nutrition, there is also a growing issue of overweight and obesity among learners in urban areas. This dual burden underscores the need for a balanced approach to health and nutrition programs, focusing on both undernutrition and overnutrition. DepEd's commitment to health, nutrition, and WASH through the Oplan Kalusugan SA Department of Education and the Comprehensive Water, Sanitation, and Hygiene in Schools program demonstrates its recognition of the critical link between well-being and educational outcomes. By implementing these initiatives, DepEd ensures that learners have access to the necessary support for their physical and mental development, enabling them to thrive academically and socially. Continued monitoring, stakeholder collaboration, and targeted interventions remain essential to the success and sustainability of these programs, ultimately fostering a healthier and more productive future for Filipino students.